There's something to be said about independence, being able to wake up in your own bed and live in your own home. Living on your own means everything, even if it requires getting a little help. Each month, close to 450,000 people statewide are able to get that help and retain their independence, thanks to in-home supportive service providers like you. Hi, and welcome to the In-Home Supportive Services, or IHSS, Provider Orientation. You are about to become a part of a very special group of people. Currently, there are close to 500,000 individuals in California who have already enrolled as IHSS providers to help people to continue to live safely in their own homes. Most people, including those who are elderly or disabled, prefer to live in their own home. A person's home is where they feel most comfortable and where they can remain a part of their community and make decisions which affect their quality of life. The benefit that living in one's own home brings is a sense of independence, comfort, and peace that comes from familiar surroundings. You, the IHSS care provider, are critical in making it possible for IHSS consumers to remain safely in their own homes, where they can enjoy their personal freedom and independence, continue being part of their community, and avoid the unsettling and undesired feelings that out-of-home care can bring. Without IHSS care providers like you, this would not be possible. During this presentation, I'll be giving you some basic information about the IHSS program, and we'll also try to give you a better understanding of the program's expectations. Now, we'll be referring to you, the person providing the services, as the provider or employee, and the person receiving the help is either the consumer, recipient, or more frequently the employer. Now, this individual is considered the employer as he or she has the authority and the responsibility to hire the care provider, also supervise their work, define how the tasks will be completed, and can also terminate the provider if he or she chooses to. So let's start things off by talking a little about the IHSS program and what you'll be doing. The In-Home Supportive Services program provides services to income-eligible people over the age of 65 and the blind and/or disabled. The goal of the IHSS program is to allow people to live safely in their own homes and avoid the need for out-of-home care. IHSS allows the recipient to hire someone to help out with services such as housework, laundry, meal preparation, and personal care. Personal care may include bathing and dressing services. In addition, paramedical services such as wound care are also available as part of the IHSS program. In order to qualify for IHSS, services almost always need to be provided in the recipient's own home. This could be in a house, apartment, hotel, or the home of a relative. The recipient can choose to live in any type of home they desire, as long as it is not an acute care hospital, skilled nursing, intermediate care, community care, or board and care facility. There are times when some services can be provided outside the home, such as when you accompany the recipient to the doctor. There may be times when services may also be provided in the workplace, or when the recipient travels on vacation and you accompany them. You should always make sure that your employer or recipient has informed their social worker in advance to verify if your circumstances will qualify for IHSS payment. IHSS is a Medi-Cal program and is funded by federal, state, and county dollars. Therefore, recipients must meet all Medi-Cal income eligibility requirements to receive IHSS services. So that's a little bit about the program. Now let's talk about you and the requirements for IHSS providers. One of the first things you have to do is attend a provider orientation to get specific information about IHSS rules and regulations and IHSS program integrity. The good news is that watching this DVD is part of your orientation, so you're already well on your way. Once we're done with this orientation session, you'll be asked to sign the Provider Enrollment Agreement form. By signing this form, you agree that you will provide the authorized services. You understand the program's expectations as described in today's orientation. You will cooperate with the state and county staff to provide necessary information. You are aware of measures that the state and county may take to enforce program integrity. You understand that if you do not follow the rules and requirements to be a provider, you may be fired from providing services through the IHSS program. You are acknowledging if you have certain prior criminal convictions. And the information you're giving is correct under penalty of lying under oath. As part of the enrollment process, you'll also need to set up a time to get fingerprinted so a criminal background check can be done. Even if you have previously had your fingerprints taken for something other than IHSS, such as school or a prior job, you'll still need to do it again to become an IHSS provider. Also, if you stop working for IHSS for more than a year, you will need to have your fingerprints redone. If you provide services for multiple recipients either in the same county or in different counties, you'll only need to be fingerprinted once. State law mandates that you are responsible for paying all the costs related to the fingerprinting and your background check. Your county IHSS office or IHSS public authority can give you a list of nearby locations where you can be fingerprinted. If the criminal background check finds that you have been convicted of certain crimes, you may be ineligible to become an IHSS provider or employee. There are two categories of crimes that will make you ineligible. They are referred to as Tier 1 and Tier 2 crimes. If in the last 10 years you've been convicted of or incarcerated following the conviction of certain crimes, you are not eligible to be enrolled as an IHSS provider employee or to receive payment from the IHSS program, even if your crime was removed from your record. On the other hand, for some crimes, you may be able to be a provider if you receive a waiver or general exception. Now, this is a lot of information to absorb. You can find all the requirements and the definitions of Tier 1 and Tier 2 crimes explained in detail in the handouts included in your packet and the implication of each on your employment status. There are two more important requirements that you should know and understand because as an IHSS provider employee, these laws apply directly to you. They are confidentiality and mandated reporter. First, confidentiality. You probably know that when you go to a doctor, your confidentiality is protected. This means that your doctors are required to keep all of your medical information private. These same rules apply to all healthcare providers and hospitals, and they also apply to you as an IHSS provider. You cannot give any information about the services your consumer receives, even including that they receive help from IHSS. You also cannot discuss any information about your consumer with any unauthorized individuals or organizations without the written permission of the consumer or the person who is legally responsible for that individual. Anyone sharing information inappropriately about someone they care for is guilty of a misdemeanor. Now let's talk about what it means to be a mandated reporter. As an IHSS provider, you are a mandated reporter. This means that by law, you must report any suspected abuse immediately to the County Adult Protective Services or Children's Protective Services. There are several types of abuse that must be reported, including physical abuse, mental suffering, abandonment, isolation, financial exploitation, neglect, self-neglect, abduction, and sexual abuse. The information about who reported the abuse will be kept confidential, and you can refer to the mandated reporter handout for more details and information about what you should do if you suspect someone you're caring for is the victim of abuse. As you know, IHSS is a huge program in California made up of nearly 1 million consumers and providers. To make a program this large run as smoothly as possible, many agencies need to be involved. While it's great to have support on multiple levels, this can sometimes add to confusion as to who you should contact when different situations come up. Let's take a quick moment to break down how everything is structured and who handles what part of the process. The federal and state governments provide oversight and direction to the counties. These counties are responsible for managing the IHSS program on a local level. A county social worker will conduct an assessment. This assessment process includes identifying which services the recipients require to remain safely in their own homes, how much help is needed, how much time it takes to provide the services, and how often they must be done. The social worker will take into account the different levels of need on good and bad days. The counties also enroll providers in the IHSS program, answer questions from recipients about IHSS, and participate in fraud detection activities. The Department of Health Care Service auditors and County District Attorney's Office and welfare investigators all investigate potential fraud when cases are referred to them and prosecute those accused of fraud. There are 56 IHSS public authority agencies throughout California. If there is a public authority available in your county, these agencies are responsible for maintaining the county's provider registry, making provider referrals to recipients, and offering access to provider training. Public authorities are also responsible for performing collective bargaining, as well as providing wage and health benefit information to providers. Now we're going to talk about what services IHSS does and doesn't cover. You should have a handout which says services covered by IHSS. In it, you'll find a complete list of the services and tasks that you may be authorized to provide for your recipient employer. So let's say you're providing assistance to someone who is unable to do house cleaning or personal care. IHSS can pay for you to assist with meal preparation and cleanup, laundry, shopping, bathing and oral hygiene, feeding and dressing. Also, each service has a list of specific tasks that you should be familiar with. All the approved services and tasks can be found in your handout. There are a lot of services available within the IHSS program. However, you will not have to provide all of these services for the person you're caring for. Only the IHSS services that are authorized for that individual. The county is required to authorize only the services the recipient needs to remain safely at home. Each recipient will receive a list showing what services you can be paid for providing and how much time is authorized to do them each month. This list is called a Notice of Action. Before providing services to an IHSS recipient, you should ask the recipient to tell you which IHSS tasks have been authorized, the number of hours, and the schedule you are being hired to work. Starting in 2012, all providers will receive a notice that contains a list of approved services for their recipient. Remember, IHSS will only pay you for a service or task that has been authorized. However, the recipient you work for may choose to pay you to provide services that the IHSS program does not pay for. This agreement would be between you and your recipient. If your recipient asks you to do something that is not on the list of services or tasks, or asks you to do something that has not been authorized for them, you will not be paid for doing what they ask. In these situations, it's generally best to politely remind them about the Notice of Action list and services that are authorized. If you do choose to do something that is not on the Notice of Action, you cannot put the time it takes on your timesheet. Some of the things IHSS will not pay for include moving furniture, paying bills, reading mail to your recipient, caring for pets, including service animals, gardening, sitting with them to visit or watch TV, taking the recipient on social outings, reimbursement for gas or transportation expense, time waiting for the recipient in the doctor's office, and repair services. You may also find there will be times when previously approved services are not covered. For example, you'll not be paid for providing any services if your recipient is in a licensed care facility. Generally speaking, the same also applies to cleaning your recipient's home if they go into a licensed institution. However, there are a few exceptions to this rule. If you find yourself in this situation, be sure to ask your employer recipient to verify with their county worker first before you do anything. If your employer is hospitalized or passes away, you cannot claim hours and/or be paid during their hospitalization or after their death, and should notify the county social worker immediately. If you intentionally claim for time worked on your timesheet for services in either of these situations, you will have to repay any money that you received and/or may face criminal penalties. In addition to the authorized services and tasks for your recipient, there is also a set amount of hours approved for each service per month. You will not be paid for any time above those monthly hours that have been authorized. If it consistently takes more or less time to complete the authorized tasks, you should have your employer report these changes to their county social worker. The county worker is required to reassess the recipient whenever there is a change in circumstances affecting their need for services. If your employer refuses services you have been authorized to do, you need to make sure your timesheets do not include hours for these services. If they always refuse to have you do specific services, you need to make sure that they let their IHSS county worker know so they can update their records. You must also keep in mind the recipient may have multiple providers and may choose which providers assist them with certain tasks. As you can tell, it's important that your timesheet only reflects the time you have spent doing authorized services and tasks. It's never okay to put time on your timesheet for hours not worked. Deliberately filling out your timesheet with incorrect information is a serious issue and can carry some serious consequences, including being considered as criminal fraud. As we said earlier, IHSS is a Medi-Cal program funded by federal, state, and county dollars. This means that IHSS fraud is Medi-Cal fraud. The California Department of Health Care Services is responsible for investigating Medi-Cal fraud. Reducing and eliminating fraud helps save IHSS program resources. If you suspect anyone may be committing IHSS or other Medi-Cal fraud, you must report this to Medi-Cal by calling the toll-free number, sending an email, filling out an online form, or contacting the county. You do not have to have proof of fraud. There are investigators who will determine whether Medi-Cal fraud has been committed. In addition to public reporting, fraud may be detected in several ways, including through computer matches with other federal and state agencies, during the assessment process, while the county and/or state staff conduct quality assurance and fraud detection activities, and during authorized unannounced program integrity visits to the homes of recipients by state and/or county staff. The following video shows some real examples of how actual IHSS recipients and providers tried to take inappropriate advantage of the IHSS program. The result? Criminal fraud and some pretty significant penalties. While the stories are true, actors have been used to portray both the recipients and the providers.
In-home supportive services provide help for those in need. It's important to preserve the program resources and avoid fraud. We know these examples represent the minority, but it is important for you to understand what is considered fraud. Understanding the rules can help you avoid a situation that can have significant consequences. Let's look at a few examples. This is Shirley Sayer. She thought she could be in two places at one time. She was an IHSS provider for her son in California and moved from California to Colorado and still claimed IHSS benefits. That is illegal. Shirley requested that her checks be mailed to a post office box in Riverdale, California, and then forwarded to her address in Colorado. She submitted timesheets claiming she provided IHSS services for her son in California for 5 months. Shirley is now serving 180 days in jail with 3 years probation. Here are the Shibosians. Charlie was the provider for his father Earl, who said he had functional limitations, but was caught on tape showing this was not true. Because Earl was not disabled, the timesheets submitted by Charlie were fraudulent. Viola was the IHSS provider for her mother Gracie, who was also caught on tape showing that she overstated her condition. As a result of Mom and Dad overstating their needs, their children received over $70,000 in false benefits. They are all serving time now. Malay was the provider caring for her sick father Vaughn, who was hospitalized and died in March of 2005. Malay submitted timesheets for the care of her father while he was in the hospital and for 2 months after his death. Malay is serving 120 days in jail with 1 year probation for timesheet fraud. For 3 years and 8 months, David was a provider and Joe was a recipient. David didn't actually perform any services for Joe because Joe didn't actually have anything wrong with him. When the checks came in, they split the money. Joe and David are serving 90 days in jail with 3 years probation for IHSS fraud. The in-home supportive services system can be abused in many ways, and the consequences for intentionally abusing the system are devastating to you and your family. If you have a question or are unsure of IHSS policies and procedures, ask for help. If you assume and you are incorrect, you could be liable for your mistake. The District Attorney's Office takes all fraud cases seriously.
The information shown here is also included in your packet. Remember, by being aware of both the IHSS program rules and your own responsibilities as an IHSS provider, you can help protect the integrity of the IHSS program. The purpose of this video is to provide both you and your provider with information on how to correctly complete a timesheet for the Case Management Information and Payrolling System, also known as CMIPS 2. With this new statewide payrolling system, CMIPS 2 timesheets are no longer processed at your county IHSS office. Instead, they are scanned into an automated computer system at the timesheet processing facility in Chico, California. This means that CMIPS 2 timesheets are not viewed by a live person, so special care must be taken to fill out timesheets correctly to avoid payment delays. In this video, we will help you and your provider learn how to correctly complete a CMIPS 2 timesheet, understand general timesheet processing information and timesheet responsibilities for both the IHSS recipient and provider, and prevent common CMIPS 2 timesheet mistakes that can delay provider payment. Let's begin by reviewing the 14 important steps that you and your provider need to follow to correctly complete and submit a CMIPS 2 timesheet to avoid payment delays. 1. As the provider, make sure you and your recipient are clear on how many hours you worked before you sign the timesheet. If you do not agree with the number of hours you actually worked, do not sign the timesheet. 2. You may only enter time spent doing authorized services that you specifically worked. You will receive a letter from your county IHSS office explaining your recipient's authorized services for the entire month. This letter is called the IHSS Provider Notification. Remember, you will not be paid more than the number of hours authorized for your recipient. If you also provide care for additional IHSS recipients, you will need to fill out and submit a separate timesheet for each recipient. 3. Do not write over pre-printed information or alter the timesheet in any way, including changing pay periods, dates, names, remaining hours, or folding the timesheet. 4. One major change in CMIPS 2 is that you must only use black ink when filling out your timesheet. Some examples of things you cannot use are a pencil, red ink, or blue ink. You also cannot use correction tape or fluid to fix an entry. If you make a mistake, you should neatly cross out what is wrong and neatly enter the correct information. 5. Timesheets are only valid for the person and pay period listed. Do not cross out or change the names or pay periods in the boxes at the top of the timesheet. Do not write anywhere on the timesheet except in areas designated for hours, minutes, signatures, and dates. If you make a mistake, do not initial the correction. Neatly cross out the wrong number and enter the correct number. Write only one number per box and stay within the lines. It is suggested that you test your pen before completing your timesheet and press down firmly so the writing can be read by the equipment used for timesheet processing. 6. If you did not work on a certain day, you should leave the box for that day blank. Also, on CMIPS 2 timesheets, you should not write over pre-printed zeros, as this may cause extra delays in processing your timesheet. Pre-printed zeros may exist in instances where you began working in the middle of the pay period, and the boxes prior to your start date have zeros entered into them. If you mistakenly write over pre-printed zeros, you will need to contact your county IHSS office to request a new timesheet. 7. Another major change in CMIPS 2 is that you must write in the time you worked in hours and minutes each day. The good news is that you no longer need to change minutes to decimals. For example, if you worked 4 hours and 45 minutes, you would enter 4 in the hours box and 45 in the minutes box. There is a box provided for each number. Please write neatly, clearly, and press down firmly with only a black ink pen. 8. When the pay period is complete, you should add up and then enter the total hours you worked for the pay period in the total box. Make sure you have correctly entered your daily hours and minutes worked. You should write neatly, clearly, and press down firmly with a black ink pen. If the numbers are hard to read, your paycheck may be delayed. 9. Both you and your recipient must sign and date the timesheet. Timesheet submitted without both signatures will be rejected for payment, and another timesheet will have to be resubmitted. This will cause a delay in receiving your paycheck. These signatures and dates must also be after the pay period for which the work was done, and the timesheet cannot be submitted before the last day in the pay period. Finally, remember the space for the recipient and provider signatures is on the back of the CMIPS 2 timesheets, and never sign an incorrect or blank timesheet. 10. You should gently tear the timesheet from your pay stub along the dotted lines. Please be careful not to tear off important information, such as signatures, hours, or dates. If this happens, it will delay your payment as you will need to request a new timesheet from your county IHSS office, and then complete and submit a new timesheet. When you separate your timesheet from the pay stub, you should be careful not to make any other tears to either document. 11. Once your timesheet is complete, you should make a copy of the timesheet and mail the original to be processed. After you've sent in your timesheet for processing, you should receive your paycheck within 10 working days of receipt by the timesheet processing facility. Remember, your CMIPS 2 timesheets are not viewed by a live person. They are computer scanned, so any of the above-mentioned mistakes may delay your payment. Please review your timesheet for errors before sending it to the timesheet processing facility. 12. You should not submit any additional documents with your timesheet, such as change of address forms, Post-it notes, information for your county IHSS office, or any other legal documents such as copies of death certificates, Social Security cards, or driver's licenses. These types of documents should be mailed directly to your county IHSS office. The timesheet processing facility will not process any other information. If you send any additional documents intended for your county IHSS office, there will be a delay in your county receiving them. 13. Timesheets are due as soon as possible after the 15th and the last day of each month. You should mail your timesheets to the timesheet processing facility located in Chico, California. This address is located on the timesheet envelope. If you lose your return envelope, the timesheet processing facility address is also located on the back of your timesheet above the signature line. It is important to note that CMIPS 2 timesheets will no longer be processed at the county IHSS office. 14. If you move, you must contact your county IHSS office or public authority to request an address change form. You must complete and return this form to the county IHSS payroll office within 10 days of moving. IHSS paychecks will not be forwarded by the post office. If the payroll system does not have your correct address, your paycheck will be returned to the state controller's office as undeliverable. If you follow these 14 steps in completing your CMIPS 2 timesheet, you can avoid unnecessary payment delays. Remember, your CMIPS 2 timesheets are no longer viewed by a live person. They are computer scanned, and any of the above-mentioned mistakes may delay your payment. The IHSS recipient employer is responsible for verifying the number of hours a provider works each day for them. As the employer, you should be checking to make sure the correct number of hours is entered correctly on the timesheets to avoid payment delays. Here are some reminders and suggestions to help you complete the timesheet submission process. There are 2 pay periods in a month, the 1st through the 15th and the 16th through the last day of the month. When your provider begins working, a blank timesheet will be provided for their use until their first paycheck arrives. After that, they will receive pre-printed timesheets that will be attached to the bottom of their paycheck. Once your provider has worked for you for a period of 2 weeks, it is now time to verify and approve the hours worked for payment. If you have more than one provider, you will need to decide how many hours each provider should work each month. It is your responsibility to let each provider know how many hours are assigned to them. You must also complete Form SOC 838, the IHSS Recipient Request for Assignment of Authorized Hours to Providers form. The purpose of this form is to designate the number of hours assigned to each of your providers. Make sure you and your providers are clear on the number of hours of work for each day of the week. Also, ensure that each of your providers know their share of the hours allotted for the entire month and do not exceed that amount. If multiple providers claim more than your total allotted hours, their paychecks will be reduced. If you need help with this process, contact your county IHSS office. The authorized hours should be spread throughout the month to ensure that your care needs are met. In most cases, hours worked the first half of the month should be about half of your total hours. You may use a calendar or other tool to record the amount of time worked by your providers. One way to record hours accurately is to write down the number of hours worked each time your provider works for you. Before signing the timesheet, compare the hours your provider has written on their timesheet with your records to make sure they included only the actual hours worked. And remember, providers are only eligible to be paid for the authorized hours they worked. As a helpful reminder, the following are some of the most common CMIPS-2 timesheet mistakes to avoid. Timesheet is sent to the county IHSS office. Information is left out. The back of the timesheet is not signed and dated by both the recipient and the provider. Using a pencil, any color of ink other than black, or correction tape or fluid to fill out or correct the timesheet. The numbers cannot be read as they have not been written firmly enough to be properly scanned. The number of hours worked is not properly written in the correct box on the timesheet. The number written in the box was an error and the provider did not correct the number properly. Provider's initial timesheet corrections. Providers tear off necessary information from the timesheet while detaching the perforated area from the pay stub. The timesheet is mailed before the last day worked in the pay period. More hours are claimed than were authorized for payment. Including extra documents with the timesheet. Writing on the timesheet anywhere other than the signature area and the time entry boxes. The time entry boxes are to be used for numbers only. Crossing out or writing over pre-printed zeros. Folding or otherwise altering the timesheet. Making any of these mistakes may cause a delay in payment because the timesheet will be returned for corrections and you will need to request a new timesheet from your county IHSS office. We hope this video has helped you and your provider better understand how to correctly complete a CMIPS-2 timesheet and how to avoid timesheet mistakes and payment delays. Please remember to use the following timesheet resources in order to avoid payment delays. The 14 necessary steps to correctly complete a CMIPS-2 timesheet, the additional tips to avoid CMIPS-2 timesheet problems, and examples of the most common CMIPS-2 timesheet mistakes to avoid. Not only will correctly completing a CMIPS-2 timesheet help your provider receive timely payment, more importantly, it will prevent any unnecessary delays in your IHSS program services. After viewing this video, if you have additional questions about how to correctly complete a CMIPS-2 timesheet, contact your county IHSS office or public authority. Or you can visit the California Department of Social Services website at www.cdss.ca.gov.